How often have you heard someone say, maybe even thought it yourself, I can make it, the hospital is just down the road. That feeling of, I'll handle it myself.
Oh, absolutely.
Yeah.
Especially that common phrase in India, main khud chalalunga.
Exactly. Hospital, topas, he, hai. But today we're diving into why that instinct, that independence can be, well, downright dangerous in a serious medical situation. We're talking about why driving yourself when you've got, say, really bad chest pain or you're suddenly super dizzy or bleeding heavily, why that's nearly always the wrong move.
Yeah, it's a critical topic. And for this deep dive, we've looked at advice from emergency medical folks, safety guidelines, best practices,
Right.
and even sort of the background thinking behind hospital quality standards, like from JCI and NABH.
Okay.
The goal isn't just to say, don't do it, because, the risks can seem obvious sometimes. It's more about understanding why we feel that urge and how to make the truly safest choice.
Because time matters desperately.
It does. But getting there safely, that maybe matters even more.
Okay, let's get into that urge then, that feeling of, I should drive myself. It feels, I don't know, natural for a lot of people. Why is it so risky when your body's clearly sending up flares?
Well, it's interesting, isn't it, that self-reliance, which is usually a good thing, can actually cloud our judgment in an emergency.
Like a bias?
Kind of, yeah. Some sources suggest giving up control, letting someone else drive, feels like a bigger threat than the medical one, weirdly enough. Think about a heart attack. The pain hits. You get that fight or flight feeling. And for some, the fight means grabbing the keys.
Taking control, even if it's the wrong kind of control.
Exactly. And the immediate danger, the really obvious one, is collapsing. Suddenly passing out from pain or dizziness while driving.
Catastrophic. For you, for anyone else on the road, accidents waiting to happen.
Right. And beyond that, think about what's not happening in your car. There's zero monitoring.
Yeah, I was just thinking that. It's not like an ambulance where you've got paramedics. I remember from CU42's Lifelines, they mentioned paramedics can start things right away.
Precisely. They can give oxygen, check your heart rhythm with a monitor, things that can make a real difference even before you reach the hospital doors.
That's a huge difference.
It is. And then there's the time factor, practically speaking. An ambulance call often means the ER is ready for you. They know someone's coming. They have some idea what's wrong.
Whereas if you drive yourself...
You're potentially struggling to find parking, right? While feeling awful. Then you have to walk in, explain everything from scratch at the desk. All those minutes. And they just tick away.
And those minutes are golden, aren't they? Especially for things like heart attacks or strokes. Lifelines mention that too. The whole time is muscle, time is brain idea.
Critical time lost. It leads back to that, I'll tough it out, thinking. People maybe downplay how bad it is.
Thinking it's not that bad yet, or it's only a short drive.
Which touches on, how we perceive risk, why driving ourselves feels less risky than calling for help sometimes. Maybe it's wanting autonomy or not wanting to, bother anyone.
Could be. So, okay, we agree driving yourself is a bad idea in these serious moments. What are the better choices? The smart moves. Let's start with the big one, calling an ambulance.
Right. The obvious and usually the best alternative. The benefits go way beyond just getting a ride.
Like the trained professionals you mentioned.
Exactly. They start assessing and treating you immediately right there or on the way. Oxygen, monitoring, like we said. Plus, in India, you have the 108 number pretty much everywhere.
And private hospitals often have their own ambulances too, right?
Yeah, many do. Tune in for 47 services. They're equipped for emergencies. They know the protocols. They talk to the hospital so the ER is prepared. Advance notice helps immensely.
Okay, but what if maybe an ambulance seems like overkill or isn't right there, or the situation feels serious, but maybe not, sirens blaring serious yet?
Well, even then, driving yourself is still usually the worst option. Getting anyone else to drive you is much, much safer.
A friend, family, neighbor.
Yeah. They can focus on driving. You can try to stay calm, monitor how you feel, and crucially, they can help when you get there.
Right. Help with information, paperwork.
And if you, God forbid, lose consciousness or can't communicate, they're there to explain what happened. Even asking, say, a security guard for help is better than getting behind the wheel yourself when you're unwell.
It really sounds like thinking ahead, even just a little, makes a huge difference here.
Oh, absolutely. A little preparation goes a long way, like having emergency contacts easy to find in your phone.
Simple stuff.
Simple but vital. Knowing which nearby hospitals are best for certain conditions if you have them. And like Lifelines suggested, maybe keeping a small bag ready.
Especially if you live alone or have chronic issues.
With ID, maybe recent medical reports, it just smooths things out when you arrive, takes one less stressor off the table.
Okay, let's really hammer this home. What are those absolute red flag situations? The times when driving yourself is just completely off the table, non-negotiable?
Okay, drawing straight from the sources we looked at. If you have any of these, don't drive.
Yeah.
Severe chest pain or pressure.
Okay.
Sudden, really bad dizziness, or actually fainting.
You're right.
Trouble breathing, shortness of breath,
Mm-hmm.
heavy bleeding you can't control,
Okay.
severe abdominal pain that just hits you out of nowhere,
Yeah.
a head injury where you feel confused or you passed out, even briefly,
Got it.
or any kind of seizure or convulsion.
Mm.
In any of those cases, just don't drive. Full stop.
Even if the hospital seems close.
Even if it's 5 minutes away, that drive could make things worse, cause an accident, delay the care you desperately need.
And this advice isn't just for ourselves, is it? It's also crucial if you're looking after someone else.
That's a really important point. If you care for someone elderly or kids or someone with a chronic illness, you need to talk to them about this.
Make sure they know not to drive themselves if something serious happens.
Exactly. Make sure emergency numbers are saved in their phone, easy to find. Maybe look into local medical alert systems or apps to anything that makes calling for help quicker and easier for them.
You know, this whole discussion really underscores how important it is to get to the hospital safely and quickly. It makes me think about the bigger picture, the quality and safety inside the hospitals. We mentioned JCI and NABH earlier. How do they fit in?
It's an interesting connection, right? Because organizations like Joint Commission International, JCI, and India's NABH, they mainly focus on standards within the hospital walls.
Setting benchmarks for care, safety protocols.
Exactly. JCI does this globally across like 70 countries, pushing for better patient safety for over 20 years. And NABH does crucial work specifically for Indian healthcare providers, driving quality improvement here.
So they're not telling you how to get to the ER.
No, not directly. But by focusing so intensely on high standards of patient safety and quality care, they implicitly highlight why getting to that care safely is so important.
It reinforces the whole point. You need to arrive in a state where they can actually provide that high-quality care effectively. Their work creates the environment.
Precisely. It fosters a culture of safety. And arriving safely is, well, step one for that whole system to work for you.
Okay. And one more thing we found from the Lifelines material was about the Good Samaritan law in India. How does that factor in?
Yeah, that's about the community aspect. The Good Samaritan law basically gives legal protection to people who help accident victims.
So people aren't afraid to step in.
Right. It shields them from liability for medical bills or getting hassled by police as long as they acted in good faith trying to help.
That's important.
It is. You can even remain anonymous. You're not forced to stick around the hospital. It encourages people to help each other in emergencies.
Which indirectly might mean fewer situations where someone feels they have absolutely no choice but to try and drive themselves when they shouldn't.
Potentially, yes. It fosters a more helpful environment.
Okay, so let's boil this all down. If there's one single message, the absolute key takeaway from this deep dive today, what is it?
It's really simple and really clear. If you are having a serious medical emergency, do not drive yourself. Don't even think about it.
Your priority is getting help safely.
Survival. Getting help safely and quickly. That has to be number one. Forget about controlling the vehicle.
Right. And on that vital note, here's something for you, our listener, to think about. Have you actually considered your own plan for a medical emergency? Are you sure that plan puts getting safe, fast help first, above that instinct to just handle it yourself?
Knowing how critical time is, what step could you take, maybe even today, to make sure you or your loved ones get the best possible help, the fastest and safest way when you need it most?